At Caresyntax, we are on a mission to make surgery safer and smarter, and we primarily do that through the collection of data within the operating room. Right now, a lot of data in the operating room is siloed, which means it's very difficult to know what is actually happening within the operating room in a way that we can make systemic changes to improve surgical outcomes. Through the Caresyntax platform, corporates for the first time ever have access to data, and they can actually see what is happening within the operating theatre. This is really important because it means that they can actually make systemic changes to improve surgical outcomes through the use of the data that we are collecting. So corporations often have hundreds, if not thousands of employees. This can make it very difficult, especially for startups, to know who the right stakeholders and people are to speak to if they want to develop a solution alongside a corporate. This is a challenge which Caresyntax was faced with quite a lot. We would spend a lot of time, and this caused a lot of inefficiencies, just trying to find the right person to speak to in a corporation. Plug and Play were able to help us by introducing us to the right people. So instead of spending time trying to find the right person, we could spend time with the right people developing solutions. As a Plug and Play portfolio company, Plug and Play were able to help Caresyntax get introduced to the right people. They have introduced us to a lot of strategic corporates, for example, medtechs like Zimmer Biomet. Having strategic relationships like this have really helped Caresyntax expand our distribution and scale over the past 5 to 10 years. As Caresyntax has grown and we've gone through various fundraising rounds, Plug and Play has continued to support us and also introduce us to a lot of new investors. One example of where we've had a really positive outcome of working with a strategic partner and a corporate is when we were working with a US hospital a few years ago. We were also working with a medtech company. The issue that this hospital had was they were doing their ventral hernia repair, a pretty routine operation at a loss. So whilst working with the hospital and the medtech company and looking at all the data that we were collecting, whether that is surgical data, financial data, electronic health records, we were able to provide various insights and recommendations. This was really a positive for Caresyntax. We were able to see a 55% reduction in post-operative opioid use, a 34% reduction in length of stay for patients after the hospital. It really was an important proof point for us because it showed that the data that we're collecting and the recommendations that we're giving are actually helping improve surgical outcomes across various perspectives, be that operational, clinical, or financial metrics.